Welcome to the Renal Research Institute's Frontiers in Kidney Medicine and BioIntelligence, where we share knowledge and advances in kidney research with the world. In this episode, I'm joined by Ingrid Adelsberger, a National Board Certified Health and Wellness Coach who has lived with a chronic disease for 15 years. Together, we're going to discuss the power of health coaching, exercise, and nutrition with chronic conditions. Welcome, Ingrid.
Thank you for having me, Len.
Absolutely. So, Ingrid, of course, I find this a fascinating topic, and I think just to start off, I think it's important for people to understand what is health coaching and also what brought you to this profession. What got you interested in health coaching?
I think the story that maybe most health coaches and I share, which is our own health. So I have been diagnosed with multiple sclerosis almost 15 years ago, and I wanted to know what else there is for me to do other than just taking medications. So I found a lifestyle management program, which means diet and exercise, meditation, supplements, all these things, but it's evidence-based, and that really got me curious about what are other diseases and other things that you can do, and I wanted to help people then. And I realized that there is really a gap, I think, between the doctor or the nutritionist and the patient, because you walk out the door and they give you a menu plan, or they tell you you are obese and you should lose weight, but then you come home and you're like, what should I do? What is the next meal I'm going to have? And that is really what got me into it. And I wanted to find it out for myself and also help others. And then I think part of the question also was what health coaching actually is. So often people think it's like a nutritionist, or they think it's a personal trainer that helps you to get your goals, but it's really about behavior change and helping people day to day on the goals that they are setting themselves, and so they can accomplish them.
Mm-hmm. How do you think it's different? How is health coaching different from social work, psychology, psychiatry, and all these disciplines that to many people they may sound very similar?
Yeah, I think exactly what we just said. Coaching or health coaching focuses on behavior change versus psychiatry, therapists, all of them, it's more about mental health or about a trait that somebody wants to work on, and they're helping them with that. And it also is a lot about the past versus coaching is more about the present and every day and what we can do tomorrow or the next meal or something like that. And social work, I think, is more about managing systems. So, for example, if somebody needs housing, or they have a problem with insurance and they need somebody to help them with, or disability benefits, something like that.
Makes sense. I actually really like what you mentioned about looking at the past, that I think usually health coaches, that's not really what you do. But whereas I think certainly therapy, for example, or psychiatry probably looks at those things.
It does come up, but I think when you try to stay within coaching, then we really don't want to be therapists, and we should not be therapists.
Sure, makes sense. Well, I know that, of course, you have a very unique perspective internationally. I think you're in Austria right now, but you have lived in the U.S. You grew up in Vienna, and you spent quite a long time in the United States. Tell me the perspective that you think, where there's a difference between the European and a more American perspective on health coaching, for example. How is that different, and what are some of the pros and cons that you see between the two kind of continents?
Yeah, I think first, there is no perfect system. That's definitely something I have learned. Also, there's no perfect place to live. I have learned that. So I think the great thing about Europe is socialized medicine. So that means if you need something, you'll get it. It can also mean that you have to wait for a long, long time to get it. So, for example, yesterday I actually saw somebody that needs a hip replacement, and it was on crutches, and we don't know how long this will take until he gets that hip replacement. He will get it, but we don't know when. Versus in the US, I think because it's private insurances, you get these things a little quicker. And I think there's also a little more room for preventative care, which I think here is like we're just trying to make sure that everybody has everything. And obviously, we're having in the city of Vienna, it's about 2 million. We do have a large population, and obviously, it's not enough doctors, or that's probably a similar situation like you have in the US. But sometimes preventative care is really on the backbone. So right now, which I think is really interesting with coaching, is that coaching is only 10 years old, not even 10 years. And so we have gotten a few years ago category 3 CPD credits, which are really only there for data collection and kind of showing the value of coaching. And we are actually in the few months, I think by the end of the year, we will get an answer from CMS to see if coaching will get reimbursed and it will become category 1 CPD credits, which I think is really, really amazing and fascinating. So I really obviously hope that that will happen.
Do you think health coaching is picking up a little bit more in Europe than it did in the past?
I
Slowly?
think it depends on the country. I do think the
Yeah.
UK has it. I also do think that the northern countries have it. And I think we have something here too, but I don't consider it really health coaching. It's more like, it would be good if you stop smoking. Here's a
Hmm.
brochure and read about it. Or they will say like, you're overweight. Why don't you eat a little better? But there is no behavior change in that. So I don't know when it will come to Austria, for example. But I do know there is a company in the US that also is in Germany that does
Hmm.
health coaching. So I think it really depends on the country.
Well, let's talk a little bit about chronic kidney disease. Of course, Renal Research Institute is particularly focused in doing research, doing evidence generation for patients who have chronic kidney disease. And you may know, but many chronic kidney disease patients have lots of comorbidities and oftentimes very complicated patients. How do you think health coaching can help patients who actually have very many, oftentimes, comorbidities that they deal with?
Coaching works with the person where they are. So it could really help looking at that specific person and their life and their stories and what can they do, how much time do they have, how much money do they have, all of these kind of things. I think coaching is really great for that. The other thing is group coaching is also a possibility, and then maybe you can make a group coaching for somebody that, or for a group that has diabetes, or for a group that has hypertension, or something like that. And then you can really work on that specific comorbidity, maybe not on everything. But the great thing about group coaching, I actually worked for insurance in the US, and we had a weight management program. And so and it was online, you had a group. And then at the end of the session, we had a specific topic, and then everybody would put their goal in the chat. So you had the accountability with the other people, and you also had the accountability with the coach, which I think was a great system.
Yeah, very interesting. I think the group coaching idea makes a lot of sense, especially in a dialysis clinic setting, because as you probably know, oftentimes with dialysis patients show up in a dialysis clinic, and there's quite a lot of them in the clinic. So I think that makes a lot of sense.
I think that would be a really great venue while people getting dialysis, which is many hours, that actually you could have somebody come and
Yeah.
do programs with them.
Yeah, no, I think it's extraordinarily unique. I come to think of it now, I actually think it's very unique for given the setting of dialysis clinics. So
So
let's
there
talk a
we
little
come
about
back to the
nutrition.
CPT, sorry,
Yeah.
there we come back to the CPT-1 codes. If the CPT-1 category codes, if they will be approved by CMS, and I think that means Medicare will reimburse it, then that could potentially be very interesting for CKD and health coaching.
Talk a little bit about nutrition and how that's part of health coaching, but also how nutrition, I think it is so culturally different, I think, and of course, there's also a lot of preferences that people may have. There's a lot of, with dialysis patients, certainly there's a lot of restrictions. Talk a little about how nutrition can actually help patients do things better and have better health.
I mean, I learned a lot from you. Like, for example, sodium or phosphate is something that kidney patients have to reduce. But a lot of people, the things that they love to eat include a lot of sodium or other things they shouldn't be eating. And I think health coaching is special in the way that, again, we meet the person where they are at. So I would work with them what kind of food they love to eat, what culture background they have, and then see how we can change what they're eating and make it healthier. So, for example, you also mentioned that you have a lot of people from the South.
Hmm.
And so we all know they love fried chicken and collard greens and cornbread and all these
Hmm.
things. And so if you tell them that they cannot have anything like that, then they will be very unhappy and they will most likely walk outside of the door and say like, I'm definitely not going to do that. So you would work with them and see like, okay, maybe you can make those collard greens not in bacon. Maybe you make
Hmm.
it in another way. Or maybe you can replace full fat milk with no fat milk or something when you make that cornbread, something like that. And that's just one example. Maybe there is somebody that is from New York and they have an Italian background and they are like eating tons of Parmesan cheese. And we know that Parmesan cheese is aged cheese and aged cheese is higher in sodium. So is there a way that they can replace that cheese with a different cheese? So for example, fresh mozzarella, I think that's also very tasty. Obviously, there are also alternatives, meaning like non-dairy cheeses, but depending on if they like that or not like that, maybe we can find a cheese, but smaller quantity and one that has a little less fat, less sodium.
Hmm.
But it's really about when you are working with them in a session to say like, hey, what can you do today? Or what can you do this week? To
Hmm.
ask them and set, so they set the goals themselves.
Hmm. Yeah, I think probably one of the hardest things with nutrition and generally behavior change is behavior change. I think oftentimes people are not willing to do it. Have you have had examples and seen patients actually change their behavior over time because of health coaching?
Yes, I think it's really possible. I think the little secret is its consistency and not perfection. You can maybe start with a 3 minute walk around the block, or you start with a 5 minute workout from a YouTube exercise at home. It doesn't need to be that 1 hour that you go to the gym. I'm a really big believer of small changes that you can work in your daily routine. And I think the small changes make people feel confident then because they feel good about themselves and we're like, oh, wow, I was able to do that. And then they try for more. And then eventually they get to where they want to go. But the other thing is what I've said already, they set the goals themselves. It's not
Yeah.
me or anybody else coming and saying, hey, you have to do this. Like no coach is supposed to tell their patient what they should be doing. It's from them. And I think that makes it very different. And then
Hmm.
the last thing is also, I think, the accountability. Like, I think I'm a cheerleader to them. They have somebody in their corner, somebody that watches out for them a little bit. Versus, I think when you go to a doctor, the moment you're out there, the doctor is already with the next patient. Not because they are not good or they're mean or anything, it's just like how the system works, the time that they have.
As you talk about this, and I'm thinking about this a little bit more, I think seeing, of course, changes and improvements is probably what drives people to say, yes, I will adopt this change and I'll make that particular change. And I do realize with nutrition especially, it often takes time for some of these changes and the results of these changes to be visible. So I think your point about incremental changes makes a lot of sense. Well, nowadays, of course, the other thing that we're all dealing with, many of us now have access to, is a lot of digital technologies and apps and all kinds of other wearables that people can use. Tell me a little bit about how you think health coaching uses some of these technologies and whether that's something that's actually useful.
I love them. I'm a big believer of my Fitbit. I used to track my weight or what I eat or things like that. These days, I'm more about tracking my steps, and I love my sleep score every morning. And I think it's data that we can really use. So that's great. And this self reported data that
Mhm.
everybody has then and can bring to the coach or to the session or to a doctor as well. And it can really motivate the person. So for example, you were like, okay, I have 3,000 steps. I want to get to 5,000 steps, something like that.
Hmm.
But that's the one person. I think for somebody else, it's actually something daunting. They look at the data and they're like, oh my God, I don't want to do it. You know, that
Hmm.
stresses them and they don't want to do it. So it's very much, I think, depends on the person if it's good for somebody or if it's not good. And I think with everything else, it doesn't really, the apps or the devices, they don't replace a coach or a doctor or anything like this. I think it's just something complementary. Obviously, it's not a replacement
Hmm.
for human connection. And I know that sounds so cliche, but I do think it's true.
Yeah. Since you brought up sleep score, do you think the sleep score on your device is a pretty good reflection of how you feel like you slept?
I ask myself that question almost every day. I thought already you were asking me how I slept today. No, I don't know. I really don't know. I think you are more the data guy than I am. So,
Hmm.
how good can these wearables really tell? That I don't know.
Yeah. I generally find there's a pretty good correlation. I mean, of course, they use, I think, these sleep trackers, they use a variety of different things, heart rate variability and others to come up with
Yeah,
a score. I generally find a pretty good correlation. I don't think it's perfect, but sometimes I get surprised, just like you. I think I look at the sleep score in the morning and I say, well, I don't think I slept that bad, or the other way around, actually. I feel
yeah.
like I didn't sleep that well, and the score was surprisingly very high. But I do agree with you. I think technology unquestionably plays a big role, and I think it will probably play an even bigger role in this as we move forward. So when it comes to health coaching and what is success, how would you measure success, especially with, for example, dialysis patients or patients with chronic kidney disease in general? What would you say is a success?
I think it's again very personable and very different from person to person. And also, it depends on the goal. So, I think if you want to lose weight and you see a number on the scale, it's very easy to say, okay, this is success or it's not. The same thing is like when you say, like, I'm walking 10 minutes every day, and now suddenly you walk 30 minutes every day, you can see that success. But I think a lot of other things are in between the lines that somebody feels better or they have more energy. Like, how can you really tell
Yeah.
they would feel it themselves? But for CKD patients especially, I think it could be something like taking your medication on time, that after a week you see that, or that they're well hydrated. We know fluid is a big thing with CKD patients, so that they're well hydrated, that could be a success. Or also fewer hospital visits.
Yeah, no, that certainly is true. And I think with dialysis patients, I think it also has to be things like phosphate levels and potassium levels that they become more normal or within range for patients because, of course, a lot of these get really out of normal ranges, especially in dialysis patients.
I think that's pretty easy to measure. So
Hmm.
I think it's more things like, I've been working on that and this is how I feel. How do you measure that? That could be
Yeah.
sometimes tricky.
Yeah, it's much harder to measure things like stress or things that tend to be much more subjective, for example, than the more objective things like potassium or blood pressure or body weight or things like that. I think that makes a lot of sense. Well, talking about technology, let's talk about artificial intelligence. Of course, AI plays such a massive role nowadays, and everybody hears about artificial intelligence. And so, what do you think? Have you been using it? Do you think it's useful in health coaching? And where do you think things are going in that area?
I think it's useful in everything, to be honest, because you can ask it and you get so many answers. And if you keep on asking more and more, then you come down to the bottom. And I think that's great. I think it's also great for health coaching for my prep work. I don't
Hmm.
think it is useful for anything when it comes to the clients or to the patients, because it's a lot about, well, first about the relationship that the coach has with the patient, but also then what the patient does after the session that you do the work with them together. Because the real work really happens when they go home and then they implement all these things. So
Yeah.
again, I think similarly, what I answered you when we talked about the wearables is that it's not a replacement, but it is something that can help us to get more data.
Yeah. I know you talked before, you talked a little about more incremental changes and, making small changes, for example, in a diet. Do you think um, some people prefer more kind of a black and white approach, that one day they just stop doing something or they start doing something? I'm assuming there must be some people that you also have found in
Yeah,
your
the
career.
cold turkey.
Yeah.
Yeah, very much so. It's amazing. Like some people can do that, and I think I tried it, didn't work for me. So
Hmm.
I don't think that it works for everybody, but there are some people, they look at the is it data or they look at the success stories or whatever it is, and they make up their mind and they decide that's what they're going to do. And the next day they change everything and they stick with it. And that's amazing. I think it's incredible when people can do that, but I think most people cannot do that.
But I think measurement is really key. So, for example, if you didn't know how many steps you did a day, that would have been much harder to say, well, what should I be doing tomorrow? Because I think, again, the subjective number of steps is very different sometimes than the objective number of steps. So I assume that's also critical.
Yeah, I think that there is what we have said already. It's like you need the data, and I think the wearables are great because you can get that data easily. And if you don't know what is your regular day, then you cannot improve.
Hmm. Hmm. When you did that group coaching, can you tell me a little about what kind of things were you particularly focused on, or was it similar topics or different topics with the group that you were focused on?
We had a schedule. So,
Hmm.
you start with nutrition. It's a long time ago. You start with nutrition and then you go in different things, really simple. You start with like carbohydrates, protein, and
Hmm.
fat, and kind of explain that. And then you talk about water. And then you had a session about junk food. And then you had a session about exercise. We had a session about sleep, I remember.
Hmm.
Some psychological stuff, definitely, where you can see the behavior change if I'm thinking back. So those were different topics. But that's also the interesting thing, is because people would put into the chat maybe what the session was about. Like, for
Hmm.
example, we talked about cutting out junk food and
Hmm.
replacing the one with the other or so. And some people would choose that goal, and somebody else would say, I want to go to bed an hour earlier today,
Hmm.
something that was completely different. And I think that's also the beauty about coaching. Like everybody should choose what works for them and what fits into their lifestyle.
Okay, so you did this, I think, virtually, but I assume
Yeah,
I assume there's also in-person sessions like this that sometimes happen as well, right? So it could be both.
for sure. And I think dialysis clinics would be perfect to do that in person during the sessions. I don't know if that's, legally
Hmm.
possible, but you have all these people there. They have to wait there for hours anyways. Why not do some intervention?
Yeah, yeah, I think, well, obviously a dialysis clinic is also quite unique because of, you sit in the same chair and you generally sit next to the same person over and over
Hmm.
again. So I think there's also some bond that I think that develops between the people. And I would think that there would be some benefit in, if you're doing a health coaching and you're doing together with a few people that are kind of the same group of people and they have a bond between them, so they actually get to know each other, or they know each other over a few years. I think that's probably also beneficial.
It could
Um,
also be the opposite, right? Because you don't want to share certain things because you know that person. So I think that online had something positive with the anonymity,
yeah.
that you could share because you don't know anybody. And back in the day, nobody would be on camera. And I
Hmm.
think if you would have this today, it would be very different, the setup. It would be like a Zoom
Sure.
where you can see everybody. But still, there is maybe somebody from New York and somebody from Florida and somebody from Milwaukee. And so
Hmm.
you have never met these people and you never see them again.
We talked a bit about nutrition and artificial intelligence. I guess one question I have is we actually, within RI, we developed this nutritional tool for dialysis patients where you can type in kind of what is your preferred menu and it comes up with a bunch of recipes that are approved for kidney disease patients. Do you yourself use ChatGPT or other Gemini or other large language models to come up with, for example, recipes that would be ideal for a given person?
Yeah, I think it's great. It depends on what it is that you want. Maybe you just put in this is what they like, or you put in this is what they have to eat. Or it's also something like I don't know what to do. Can you just give me ideas? So I
Hmm.
think AI can do all of this.
Yeah.
So yeah, it's great for that. I definitely have used that.
Yeah, I think it's very, very powerful. Talking about people and folks that you have coached over the years, what kind of people do you really like working with? And, do you have some, I think it would be nice to hear some examples of success stories.
In my group coaching setup, I would coach anybody, meaning like we couldn't choose the people, they were kind of allocated to us. So I coach people from everywhere, any sex, any age, all of it. Any diseases, but mainly, as I said, was obesity and maybe comorbidities. I think many people have diabetes too or hypertension, like classical stuff. Personally, when I coach one on one, it's normally women that have chronic diseases, or that's the area that I like to do, because I think besides my training and besides my work experience, I do also have the so-called lived experience. And
Hmm.
I have really noticed how powerful that is and how I feel great coaching the people, but also how well it's received from some of the tips or ideas or thoughts that I have. I really love working with people or with women that actually want to do something, because
Hmm.
coaching is also like when you don't have the motivation, that's the really hard thing, to get them to the motivation. But
Hmm.
sometimes you also have people that have made up their mind and they say like, I have this disease, I have this diagnosis, and I am ready to do this. And obviously, probably all coaches would say that that's the perfect client, the ones that
Hmm.
already have done that extra step or that first step. So you asked me what diseases, so I definitely, or what clients. So I definitely worked with people that have MS. I have worked with people that have HIV. I've worked with people that have cancer. Then obviously also obesity, diabetes, I don't think so. Crohn's disease,
Hmm.
those are the diseases that I can think of right now.
Yeah. I bet with something like multiple sclerosis, certainly since you mentioned that that's what you've been diagnosed 15 years ago, I very much remember that, of course, when you were diagnosed with it, there was, you wanted to do something. I think there's this, you didn't know you had it, and you suddenly realize you have this very serious condition. I assume that may also play a role, whether it's a more abrupt diagnosis versus something that develops over many years, like maybe diabetes or something that's a little more progressive of a disease, or at least you may notice small changes, but it happens over many years. Whereas I think with MS, certainly it can just be overnight that you realize you have a condition.
Is what you realize. I think what the neurologists say these years is that when you get diagnosed, it goes back 5, 10, or even more years when the first things happen. So, but I do agree with what you said. You don't notice anything until you have that first relapse or
Mm.
that first symptom that you can really notice. But you had another question about I wanted to do something. I
Hmm.
think it was also like you don't want to feel powerless. So a lot of
Hmm.
people I think come to health coaching also because they are like, there has to be something that can help me, and
Hmm.
I want to be part of that solution versus just having a doctor that says, here's the medication, please take that.
Yeah.
That doesn't feel powerful. You feel like powerless in situations like that.
Yeah. Yeah. Well, and obviously there's a more traditional, purely medical approach, which unfortunately oftentimes does not include things like nutrition. And I certainly think this is where health coaching very much augments and helps, provides additional support beyond the kind of the traditional medical pharmaceutical interventions, which is really how medicine is usually done. So,
Yeah, but the great thing is that when they both work together, I think this is
hmm.
when you can really do a lot. And when we talk about things today like obesity or diabetes or hypertension, all of these things, you can take the pill and you can get better. But I think if you also change your lifestyle, that's golden, I want to say.
Yeah. Yeah. And I guess the other benefit of health coaching, it is not a 15-minute visit like the typical doctor's
Yeah.
visits that are very timed. And at least in the US, certainly, as you know, I think many of the primary care visits end up being very short.
Yeah, no, I think
Um,
it's here also 10 minutes or so,
okay.
10, 20, maybe sometimes longer. But yes, a health coach is normally maybe sometimes 30, but most of the
Okay.
time I think is 45 minutes to an hour.
Okay, that's good to know. So, and was that also similar in a group session when you do these group sessions, or they also vary between 30 minutes and an hour generally?
This one was 30 minutes, and then
Hmm.
people also had the chance to get the so-called one-on-one, and that
Hmm.
was 15 minutes. So that would be an incremental add-on thing. Maybe they have a question or they want to work on something specific, and
Yeah.
that was shorter. But
Hmm.
again, it was a insurance setting, so I don't think they would have the resources to give everybody an hour once a week, one-on-one session.
Sure, sure. No, I think definitely makes sense. Well, Ingrid, I think you're giving me some optimism that I think, despite the chronic conditions that most of our patients have, I think there are some other things we can do to change patients' behavior. In some cases, sounds like it's an incremental change. In other cases, it sounds like maybe for some people, it's okay to do more abrupt changes. But it does give me optimism, and I just want to thank you very, very much for your time. I think it's really been incredible. So thank you, Ingrid, for joining us today. This is great.
Thank you for having me.
Thank you. And thank you to our listeners for joining the Renal Research Institute for this episode of Frontiers in Kidney Medicine and BioIntelligence. We invite you to connect with us on our social media channels and stay tuned for future episodes as we continue sharing insights and advancements in kidney research.